The clinical practice of drying off in cattle. So for the dry off period characteristics, the goal is to have better milk production. It was first implemented at World War II. The average length is 60 days, and the mammary gland involution is 1 to 2 weeks. Progressive drying off is due to endocrine regulation, such as prolactin and oxytocin. It allows tissue growing before calving and colostrum development. It is a critical period for infection, and most infections are gram-positive. There needs to be a reduction of antibiotic use. Blanket therapy was banned in 2023. So during involution, it's mostly gram-positive infections, and in the transition phase before calving, it's mostly gram-negative infections. So for drying off treatment, you need to record the drugs. And you are not allowed to use drugs for prophylaxis since February 2023. Selective therapy is only allowed if there's an over 200,000 stomatic cell count per milliliter. What you can do is seal the teat by giving bismuth subnitrate in the paraffin. This seals the teat canal and it decreases the chance of post-calving mastitis. And make sure to monitor the cow for 3 days and then after 3 weeks, and then 1 week before calving. So the gram-positive antibiotics that you can use during involution or the drying off period is benzylpenicillin, as well as cloxacillin, ampicillin, and cephalexin and cefepime. And the antibiotics you can use for gram-negative bacteria, which occurs in the transition phase before calving, is amoxicillin clavulanic acid, cefquinone, as well as cefoperazone. For management, you can have drastic drying off or gradual drying off. For drastic drying off, this is optimal when there's less than 20 litres of milk a day. This will decrease the signs. You need to have water and feed restriction for 24 hours. Drastic drying off can cause pain and discomfort, so it can be a welfare problem, and they're more at risk to mastitis. Gradual drying off is more appropriate, but you have to milk it once a day for a week, and gradually restrict the feed, but this will increase metabolic problems. Summer mastitis affects non-lactating dry cows on pasture. It's fed by bacteria which are spread by flies. The signs is pus in the udder and the teat might have to be amputated, as well as fever and abortion. For prevention, have fly repellents and have good hygiene on pasture, so remove any manure. For treatment, have isolation, antibiotics, intramammary infusion, NSAIDs, and remove any content of the quarter.